So I'm starting. I would like to welcome all of you to what I know will be an incredibly informative, eye-opening discussion about the COVID-19 virus and what it means for us, our loved ones, and our communities. I want all of you to know that we have viewers today from over a dozen countries around the world. My name is Shelley Taub, and I'm so proud to be a part of the Technion family. When I became a member of the Taub family 30 years ago, I was immediately inducted into the Technion family. I've since developed my own relationships with various members of the Technion family and made multiple visits to the Technion campus in Haifa. Visiting the campus, it is impossible not to be drawn in by the most fascinating faculty, but most especially by the students who make up the Technion engine. The most brilliant minds working together, making global strides in science and technology, all under one roof, is absolutely mind-blowing. I know the best way to help Israel is through the Technion, home of this world-class institution with some of the best and brightest minds in the world. And this is what brings us all here today. All of us have a collective interest in the health and well-being of ourselves and our loved ones. Technion President Uri Sivan has said that we are entering a time of unprecedented challenges to our health. A significant part of Technion's mission is to face these real-world challenges. In March of 2020, several labs at the Technion shifted their focus from their daily work to battling the COVID-19 pandemic. Today's webinar, Variants, Boosters, and Big Data, What Does the Future of COVID-19 Look Like?, will take you into the minds of the people who have been on the forefront of this very research. They will share with you the information that they have discovered to date regarding COVID-19, what it means for us, our loved ones, and our communities. I am so delighted to be joined today by this superior panel of Technion experts who will share their findings on the ongoing battle against COVID-19 from the very beginning of the pandemic all the way through the Omicron variant that we are faced with today. I would now like to introduce you to the panelists. Assistant Professor Dvir Aran of the Faculty of Biology and the Taub Faculty of Computer Science. Matan Levine, Ph.D. candidate in computational biology at the Technion and also an M.D. candidate at Tel Aviv University. And as a last-minute addition, we are joined today by Associate Professor Nir Gavish of the Faculty of Mathematics. Unfortunately, Professor Yair Goldberg has taken ill, and he is unable to be with us today. We wish him a speedy recovery as he watches from his home. We are also very fortunate to have Professor Roy Kishoni as moderator today. Roy Kishoni is the Henry and Marilyn Taub Professor of Life Sciences in the Faculty of Biology, a member of the Taub Faculty of Computer Science, and the immediate past director of the Lori Loki Interdisciplinary Center for Life Sciences and Engineering. Aside from being one of the most prominent names in the struggle against antibiotic-resistant bacteria, Roy most recently made headlines with his research into the COVID-19 virus. Shortly after the pandemic began, he and his team developed and tested the pooling method of expediting COVID-19 testing. Roy's lab has also contributed to the urgent understanding of the COVID-19 vaccine effectiveness at both the patient and the community level. These studies garnered world attention and were covered in the New York Times. His work has been cited as part of key public policy decisions and were quoted by CDC Director Dr. Rochelle Walensky and Dr. Anthony Fauci. Roy, it is such an honor to have you with us today.
Thank you, Shelley. Really happy to see you. Reminds me of your visit here, and I'm looking forward to more visits when COVID permitting. And I also want to thank the entire ATS team really for envisioning and putting together this highly timely and I hope interesting and informative event. Shelley, I also want to say, if I may, on a personal note, just to say thank you. You and your family, the Taub family, have just been amazing supporters of the Technion in general and of me personally, especially in my move from Harvard to the Technion. And it is really with great pleasure and pride that I carry the Henry and Marlene Taub name in my professorship title. So now let me begin. Good evening, everyone. Good evening from Israel, from Haifa, from the Technion. Like everywhere, here too, the pandemic has really shaken the environment around us and has challenged us in many different new ways. And the Technion faculty, Technion students have really come to the challenge with multiple important contributions, often at the very frontiers of worldwide research. I'll mention a few examples. On the frontier of detection of the virus, one of the very first demonstration of quick home tests of COVID that can be done without PCR machine has been demonstrated here at the Faculty of Medicine by Professor Naama Geva-Zatorsky. Pool testing, as Shelley has mentioned, is first pioneered and demonstrated here in my own lab. This method really allows testing multiple samples together and detecting even one positive sample within a pool, a large pool of many negative samples. That method has really been important in the early time of the pandemic when we were lacking test PCR kits. And nowadays in Israel, the major companies and also around the world are using pool testing to just save reagents. Technion researchers have pioneered new tools to detect the virus, the COVID-19, the SARS-CoV-2 virus, in real time in the sewage system by continuous sampling. This is a work that really is a game changer here and has been deployed throughout, surely at the Technion and in Israel, pioneered by Aran Friedler, professor at the Faculty of Civil Engineering. And moving from detection to protection, the Maya stick here is it's an interesting thing. It's a sticker you can put on your mask, and it consists of nanofiber coated with antiseptics that trap and kill the coronavirus on the spot. Also an invention coming from the Technion. And finally, but also of highest importance, is the whole notion of bringing data science, big data application, machine learning to understand how the disease is progressing, to understand the impact of vaccination. Israel in general and Technion in particular has been pioneering in this field. A lot of the research that is really has shaped how we understand the pandemic is coming from Israel, understanding, really unraveling how the vaccine impacts the risk of infection and severe disease. The work from Yair Goldberg, industrial engineering, who as we heard is sick and will not be here with us today. Understanding how the vaccine impacts transmissibility, both at the personal and community levels. A work we will hear that was done in my lab. You will hear about it today from Matan Levine. Developing models to predict pandemic dynamic and how it is affected by the vaccine. Work by Nir Gavish from Faculty of Mathematics, we'll hear about today. And really thinking about the challenges and opportunities in using live, timely data to make prospective predictions. A work by data scientist, Professor Dvir Aran from Faculty of Biology. And there are really many, many more. And really throughout these studies, it has been just amazing. I think for me, for everyone involved, to see how, you can do your research here, you're sitting in your lab and you post it, and the dissemination is worldwide. It's just like that, very, very quick, and it makes very substantial impact on national, international policy making at really the highest level. You've heard that research that came out from the Technion has been really featured in at White House briefing by Anthony Fauci, by Dr. Rochelle Walensky, CDC director, as part of really the basis for policy making at the US and more generally. Today, we will get a little kind of sampling nuggets of these studies. Matan Levine from my lab will talk about vaccine impact on infectiousness and transmission. Professor Nir Gavish from mathematics will talk about modeling the pandemic dynamics. And Professor Dvir Aran from biology department will talk about the challenges and limitation in predicting the future, if you wish. So without further ado, let me introduce Matan Levine. Matan is a student in my lab, an amazing student with highly interdisciplinary background. He's an MD Ph.D. student, but he actually started his MD after already completing a degree in natural sciences, combining physics and biology, was part of the prestige Talpiot program in the Army, and also has vast knowledge and experience working in startups and industry at the domain of machine learning and data science. And Matan will tell us about the impact of vaccination or vaccines on virus transmissibility at a personal level and community level. Thank you, Matan.
Oh, thank you, Ori, for your kind words. Hello, everyone. It's really a great pleasure to be here today. So again, my name is Matan, and I'm an MD PhD candidate at Ori's lab. I joined the lab about a year and a half ago with the idea of studying many other things that are not necessarily related to COVID. But things ended up that I researched mostly COVID and Pfizer vaccine, and I'm really happy to share this work with you today. So let's begin. When we speak about COVID vaccines, we can mention three principal benefits that we get. First, and most important, if you are vaccinated, you are much less likely to be infected. Probably many of you have seen this graph before from Pfizer clinical trial, which shows very high efficacy of their vaccine in preventing disease. But the vaccine is not perfect. Some of those that are vaccinated will be infected with what we call a breakthrough infection. And here comes the second benefit from the vaccine. If you are infected, you are much less likely to have a severe disease. But there is a third effect that was unknown if exists. And that is reducing the infectiousness of infected people. That question is very important for many reasons and has numerous implications. Think about it for a moment. If it's true, if it does reduce the infectiousness, it means that when you are getting vaccinated, you are not only protecting yourself, but also your friends, your community, and your family. So in order to find out the answer to this question, we collaborated with Maccabi Health Services, which is the second largest HMO in Israel. And if I may say a word about this collaboration, I think that in addition to the great minds that I'm surrounded by in the lab, one of the huge advantages that we have here in Israel is this kind of data sources. Maccabi collects all the medical information that you can think about in a very efficient way, so we can then analyze it and come with new insights. So when we received the data, we basically compared the viral load of unvaccinated and the viral load of vaccinated people in case of breakthrough infection. A short explanation on viral load. Viral load is the amount of viral RNA copies in your mouth and nose. So the less viral load you have, the less infectious you are. So as I said, Maccabi retrieves for us all the PCR test results. We analyzed the data, and honestly, it was wonderful. As you can see here in the graph, already 12 days after the first vaccine shot, we saw a reduction in the viral load and therefore a reduction in the infectiousness among vaccinated people. We published the results as soon as possible, and that was tremendous. Frankly, I think that this graph spread around the globe almost as fast as Omicron is spreading right now. So it was really, really great. Here you can see the effectiveness of the viral load reduction in the whole first month after the first vaccine. But this is not the end of the story, because it was unclear for how long this effect will last. So we waited about half a year. We ran the numbers again. And what we saw is that this effectiveness in reducing viral load declined over time and eventually vanished after 6 months. That was back in August. And at that point, Israel, followed by the US, the UK, and many other countries, has decided to vaccinate with a third shot, a booster shot. And fortunately, what we saw is that the booster restored the former effect of reducing viral load. I wish I could end my talk at this point, but again, the future was very unclear. Will the booster effect last for longer? Will it wane just as the second dose? So here are very recent results from about 2 weeks ago. Analyzing again the new data, we observed that the restored effect of the booster shot declines in a very similar way to what we saw earlier after the second shot. And basically, this is where we're standing today. So far, I presented our work that showed reduction in the infectiousness in the individual level. But what about the community level? Can we actually see that others are protected by us if we get vaccinated? So Oren Millman, a bright researcher from our lab, decided to tackle exactly this question. And what Oren did is taking advantage of the fact that until recently, children were not eligible for the vaccine, which means that they are the perfect control group. So Oren looked at different communities in Israel with different vaccination rates. And he could actually see that in communities with higher vaccination rates among adults, there were lower infection rates among the children. And by that, we have now the full picture. If you are vaccinated, you are not only protecting yourself, but you are also protecting your environment. So thank you very, very much for listening. And I hope you enjoyed. Ray.
Thank you, Matan. Thank you for this very comprehensive presentation. Just maybe a couple of questions. So we gave the booster, and it decayed just like the second. Its protectiveness against infectiousness, against viral load, decayed over similar time, several months, just like this, like you've seen after the second shot. And my thinking is, can you try to extrapolate what you think might happen with additional boosters?
Okay, so I think that this is really a great question. I want to make clear that so far the second booster in Israel was given only to people above the age of 60. So the available data for now is limited to this group only. Because it's so new, I haven't seen the data yet for the second booster, so I can't tell for sure how this is going to affect the viral load and infectiousness. I can tell you that we're now collecting the data and we will soon analyze it. But I think that I can speculate that we will see the same pattern that we've seen before. First, a restored effectiveness in the short period right after the vaccination, and then a decline after a few months. And again, I'm speaking only about infectiousness. I think that in regard to preventing disease, maybe Dvir probably will know better than me. In the first booster, Israel was a pioneer, with most countries following it right after. I'm not sure that this will be the case with the second booster, but it's really only a speculation.
Thank you. If I may, another question. People are thinking about variants, worrying about variants. Back in July, when we started to see a rise in the wave of infections, there was a big discussion about, is it the new variant, the Delta, that is causing this additional new wave, or is it the waning of vaccination? And I think now when we see the Omicron going up, can you speculate about the effectiveness of the vaccines, and especially the boosters, against the different variants?
I think, again, it's an excellent question, because really 2 months ago, nobody even thought about something like Omicron, and now it's the hottest topic you can think about. So we learned that things in this pandemic might change very fast with new variants. I can tell you that our study was focused on Delta variant, so we didn't compare the effect to Omicron. But again, I can speculate that to some extent, not clear yet how much, this effect will be relevant also for Omicron. In regard to variants to come, I think that the closer the variant will be to the first variant, the Wuhan strain that the vaccines were made for, the better effect we will get. I'm not an immunologist, but it's reasonable to think that the more boosters you get, the more specific the immune response becomes. So if the next strain or variant will be far enough, there will be more chances it could evade the immune response of the boosters. Anyway, I think it's a great time to open Wikipedia and look at the next Greek letters, because I think it's going to be very useful in the next month. So.
Okay. Thank you for this illuminating answer. And maybe finally, on a more of a personal perspective, like I mentioned, you have a fairly diverse background, from physics and biology and mathematics to computer science, machine learning to medicine. And I wonder how you see these different disciplines combining in research for yourself and in general, especially in the field of COVID research.
Yes, it's interesting. Ever since I started studying medicine a few years ago, we were told again and again that the best practice is following evidence-based medicine. And until not many years ago, this evidence could be very limited. And in the recent years, terms like big data and machine learning became very popular generally and specifically in medicine. And I think that my experience in those studies only emphasized for me how it's true and important. In very short time scales, we and other researchers around the world managed to analyze millions of tests and cases. And I think that this field is only becoming more and more important for physicians.
Thank you. Thank you, Matan. So let me move in and introduce our next speaker, Professor Nir Gavish from Faculty of Mathematics. And Nir will tell us about how we use modeling approaches, mathematical approaches, to understand and predict the disease dynamics and the effect of vaccination in different age groups on the dynamics of the disease. Thank you, Nir.
Okay, thank you, Roy. So I'm a professor of applied math in the Faculty of Math in the Technion. Since the beginning of the COVID pandemic, I've been intensively working on the modeling of SARS-CoV dynamics. I've not been doing this alone. I'm joining the SARS-CoV modeling team in the Gertner Institute. The Gertner Institute is the research institute, is the research institute of the Ministry of Health in Israel. This is the official body that advises the Ministry of Health and the Israeli government regarding the pandemic. So we've been involved in several projects. The first one was the design of the Israeli vaccination campaign back like last year ago. We're constantly doing projections of epidemic trajectories, and we're also involved in retrospective analysis in order to learn from the past to the future. So I want to talk today about retrospective analysis. So as you all know, Israel pioneered a very successful booster campaign back in July. This campaign essentially curtailed the Delta surge we experienced here with almost no non-pharmaceutical interventions. What we've set to do is to do an in-depth analysis of the booster campaign to understand what went on there, and also to understand questions like what would have happened if we would have modified the booster campaign, if we would have vaccinated only those of age 60 and older, or what would have happened if the campaign was delayed by 2 weeks. Okay, all those type of questions teach us for the future and let us plan better campaigns because we expect we'll need them in the future. So the methodology is very simple. We develop a model which captures at very high resolution the Delta surge dynamics. And once we have this model at hand, we start to simulate counterfactual scenarios. So let me show you the model, or at least talk about it. So I call it a world-class transmission model because we're in contact with a lot of groups in the world, a lot of modelers in the world. We copy from them, we level up with them, we share things with them, and therefore we can rest assured say that this is world-class, this is at one level with other groups, and in some cases more refined. This is age stratified, has daily resolution of the disease progression, of the vaccine efficacy profile. We use dynamical social contact patterns. We take this data from Google Mobility and other sources. And this is all highly customized to Israel. We use demographics, we use the exact vaccine and booster uptakes data. We look at clinical outcomes that are specific to Israel. All this comes from the Israeli Ministry of Health database. Now, with this data, we're still left with some parameters we can't resolve. So we take this data and calibrate it using the actual epidemic outcomes of Israel. So we have several parameters we need to fit here. We use some method called maximum likelihood. And what you can see here are data points, each one, this is of new detected cases actually occurring in Israel during the Delta surge. Each one comes from a different age group. You can see 0 to 9, 10 to 19, etc. And from different vaccine status, unvaccinated, vaccinated, boosted. So we take those 27 data series and we calibrate our model to fit to those data series. And you can see here, this is an excellent fit. The data is black, the model is red. So now we have a model that captures the epidemic dynamics in Israel at very high resolution. Now the question is, what do we do with all this? Well, the main thing we use the calibrated model to do is for this retrospective analysis. So here are some presentations I gave the Pandemic Advisory Committee and questions they were interested in. One question was on children's vaccination. When we started to vaccinate children, they wanted to know what effect it would do, and we used retrospective analysis for that. And the other one was for booster policy, especially in the booster policy going on now. So let me show you just like a slide or two from each presentation, and just to give you some feeling of that. So one question is, what would have happened if boosters were restricted to age 60 and older? You know, in the current booster campaign we have for the second booster, boosters are restricted just to that age group. So it's very helpful to know what would have happened in the past if we'd followed this policy. Is it enough or not, and so on. So what you can see here in green, this green curve, is what actually happened. This is the actual outcomes. And you see in Israel, we started giving boosters around the beginning of August or 30th of July. It started to have effect, and we were just shy of what we call the lockdown threshold. In previous surges, this is the point, the number of new severe cases at which we reached, we started a lockdown. You can see that if we hadn't given the boosters, or if we'd restricted the boosters just to age 60 and older, we'd exceed this threshold, obviously, and we reach quite close to our on-time peak of new severe cases. So we'd reach the peak loads of hospitalizations we had in the past. Okay? This would most likely require policymakers to enter or introduce some non-pharmaceutical interventions, because of course, this is a graph you see in front of your eyes, but at real time, there's always fog and uncertainty. So this would mostly result in some lockdown or some non-pharmaceutical interventions. Regarding the children, you can ask what would have happened if we'd vaccinate children aged 5 to 11 before the Delta surge. So the FDA approved the vaccination of children 5 to 11 sometime after the Delta surge. We could have answered or given the Pandemic Advisory Committee some advice or some projections on what would have happened if they started a vaccination campaign for children going into the future, talking about the Israeli winter. But then, of course, it's the future, it's projections, and there are a lot of uncertainties. So we're on much stable grounds telling them what would have happened in the past. And here you can see, this is of course with some assumptions on the uptake, consistency, and so on. But this would be the effect of vaccinating children. In this scenario, 20% decrease in cases and 15% in severe cases. Okay, so this is just some taste of this type of research. Or you want to take it?
Thank you, Neil.
Sure.
If I may follow up with a few questions.
Mm-hmm.
Maybe just again to stress for the audience that these models are the models that drives decision-making, major national decision-making in Israel. And maybe again to the point I've raised a bit with Matan about the interdisciplinary approach. You're coming from mathematics, really building models. I think this is one side. There's another side of more like the statisticians that are analyzing the data, and at the end, a lot has to happen at the interface between these two disciplines. And I wonder if you could comment on that.
Well, so I do one end of the mathematical modeling, but of course it's a big team of people, each one with its expertise. Specifically on data analysis, we have a whole different team just doing data analysis, trying to infer the modern parameters or other parameters from the real-world data. For example, in this work on boosters, we couldn't have done anything. The model would be garbage in, garbage out if we hadn't had good insights on vaccine waning. What is the vaccine waning profile, at what degree, et cetera, et cetera. And here I'm working almost on a daily collaboration with Professor Yair Goldberg, who unfortunately is here, and I'm replacing him now. But he was very much involved in preparing the grounds for this work I did now on vaccine waning. He studied real-world data on vaccine waning at a stage at Israel. We didn't know what was going on with the Delta surge. It wasn't clear why we have a surge. And he used methods that he basically developed already in the first vaccination campaign in Israel. And this is the beginning of 2021. He already started to devise statistical methods for detecting vaccine waning, and he used those in the summer. And once he pinned and was able to estimate and show everyone very clearly that vaccine waning is the driving force of the Delta surge in Israel, on the policy followed up along. I mean, the booster campaign is a direct consequence of that. On the policy was started from that.
Thank you. Thank you. Thank you for, again, emphasizing that it's very much a collaborative effort of many different people and many different disciplines that come together to ultimately make those highly important predictions that drives national and international decision-making, very important decision on vaccination and others. And if I may continue on, I think much of the data you've shown today relates to the Delta wave. And I imagine as we move from wave to wave, I imagine the models are refined and become better. And I wonder if you could first comment to what extent this is true, and if it is true, what do the models say about the current wave of Omicron here in Israel, and also if you can speculate maybe a bit worldwide. There's been, I think, the very recent data coming from the US shows that it's almost like plateauing, and I think we all want to know if it will go down soon or not.
So first of all, yes, this work we did in Delta is serving us directly here in Omicron. First of all, it's the framework. We have a model that can capture at high resolution or can fit and calibrate with high resolution to current data. And we're using exactly this model I've shown you now to understand what is going on with Omicron. Specifically, we extended the model a bit, basically for reinfections, because reinfections are much more important now. So we made this extension. And now we're using exactly the same feeding procedure, exactly the same calibration. We have those 27 data series we're extracting from the data in Israel. We'll probably go to severe cases now because we don't have detected cases as much. We're losing that data. And we're just tracking the data routinely, day by day, feeding the data, and looking at projections a week or two forward. And with whatever parameters, you know, there are many uncertainties. We just do the best fit we can do when we have this type of uncertainties. So we actually infer the parameters from the data.
Okay.
No.
Thanks. Yeah. I imagine in the Q&A that would follow, people may push stronger
sure.
on the prediction. And also, I want to mention to people in the audience that want to ask questions, please use there's a Q&A button you should press in order to ask questions. And if I may finally ask, so we had the models on Delta, we are now doing the models on Omicron. Do you think you'll be out of job after Omicron, or there's going to be more waves?
Yeah, well, you know, the first thing COVID taught us is that you can't project. You never know. So I don't think it's the last wave, like people speculate. I think we see more and more infections. I'm sure that there will be some new variant, or there's some good probability we'll see new variants that will have reinfections in the future, and that would give us subsequent waves. We can, hope for a subsequent wave that would become less violent, give us less severe cases, make it more of a childhood disease. But I don't think that COVID as COVID would disappear.
Thank you. Thank you. And again, I want to say, just to clarify for the people at home or people that are watching in the audience, we will have a Q&A session at the end after all three presentations. So please put in your questions via the Q&A button that you have. Okay, so now I'm happy to move on to our last but not least speaker, Professor Dvir Aran, who is he's a professor at the Faculty of Biology, and again, I think exemplify beautifully in the research that cross between disciplines and bring different fields together. Dvir is sitting in the Faculty of Biology, but unlike many other labs here that have tubes and experimental setups and cells and microscope, Dvir is a data scientist. He asks biological questions based on analysis of data, and he will tell us about some of the challenges and I think opportunities of using real-time data on the pandemic to make prospective predictions of the dynamics and outcome of the pandemic. So thank you, Dvir, and we're looking forward.
Thank you, Roy. It's a great pleasure to be here. Just let me share my screen. So as you said, I'm a biomedical data scientist, which means that I use and develop data science tools to study molecular data and clinical data. My main research, my day job, is around cancer genomics, immunology, and precision medicine. But in the last year or so, of course, I started playing with COVID-19 data, not like a near here, not government, just on my own at night in front of the computer. And for me, it's as a biomedical data scientist, COVID-19 data is like a data science playground. There is so much data coming from all around the world, public data that you can just download and do all sorts of analysis with it, and get so many cool results without being a part of government or HMO that can give you data. My main interest in the last year or so was to identify early indications that things are changing, like this very famous comics, identifying here that we are in exponential growth, to understand that this is where we're going. So in the last year or so, I started sharing my analysis on Twitter. I think I was the first one to show that the vaccines work quite well in the real world, just using public data. As we said, Israel was heading the vaccination of the population, and all the eyes were on us. And there was a lot of interest all around the world how the vaccines are doing. And there was a lag until the government and places, big HMOs were able to publish data. So that in that time, I developed some mathematical formulation that allowed to get a very good indication of vaccine effectiveness, and that spread on social media and with millions of views and to leading newspapers all around the world. In the wave that came after that, we heard about, again, vaccine waning and waning immunity. I think I was one of the first that showed that something is wrong, again, on Twitter. Something is wrong with the vaccines. And just later, we started using this term waning immunity. And again, the idea that we can identify those early indications, I think was, for me, it was very interesting as a data scientist, but I think also helped decision-making and others to follow. a question that really bothered me back then is what is causing this wave in Israel, the wave, the Delta wave, the last wave we had before this one. Because before that, we really believe that we are above the herd immunity threshold. There's not going to be that COVID is away. We already passed it and we can move on with our lives. All the NPIs, the non-pharmaceutical intervention, like masks and quarantines were relieved in Israel. But then cases started going up and it was unclear what exactly. And then we learned that there's a new very infectious variant, Delta, and we thought that this is the explanation. And then we understood that there is also reduction in the effectiveness of the vaccine, this waning of the immunity. And the question that I was wondered about is, what of those three really caused this wave, this surge in Israel? And I think that this question has a very important implications also to boosters and to other mitigations in Israel and all other countries that didn't yet have the Delta wave. Israel was one of the first to have this Delta wave. And it's also important to ask this question because if it's because of waning immunity, then boosters will suppress the wave. But if it's because of Delta, maybe boosters are not sufficient for that. So how do we study such a question? So for this, we developed a way to model disease spread using methodologies from theoretical physics. You can think of particles moving around, and if they touch each other, it causes infection. And particles can be modeled to behave very similarly to human. And we showed that this model works very, very well in predicting the spread in Israel. And then when we have a model that can predict, that works very well in predicting this dynamics, then we can test alternative scenarios, just like Yair presented. We can test alternative scenarios. And what we wanted to test is, what if we didn't have Delta, we just have waning immunity? Or what would we still have the outbreak, or the other way around? If we only had waning immunity and no Delta, what would have happened? So in the study that we wrote and published, we found that expectedly maybe, but actually I thought before the study, I thought the results will be different, that both of them would have pushed Israel below the herd immunity threshold. We showed that even with boosters, NPIs, non-pharmaceutical intervention, must be reinstated, or else Delta will come back. I think our prediction proved pretty well in other countries that later suffered and are still suffering from Delta. I felt very sad about countries that saw what we had and still didn't start giving boosters immediately when it was possible. Since then, we're using those methods to study something that I think is very interesting and is related to what Matan presented, which is indirect protection. So Matan presented their work, where he is in Matan work, and real world data from Israel that showed how infections of unvaccinated people went down as vaccination rates in communities went up. You can see the picture. If there are many vaccinated people around me, it would be much harder for the virus to spread even to unvaccinated people. And this is a very important feature of the vaccine, which is somehow not being used in vaccine effectiveness studies. So in this new work that we are just submitting, we are using again these theoretical physics-based models to show that vaccine effectiveness, all the vaccine effectiveness studies that were published are all overestimating the real vaccine effectiveness, the individual real effectiveness of the vaccine, because they are not taking this indirect protection into account. We show that vaccine with 85% effectiveness, we look in studies that don't take it into account as 95%. And we don't leave it there. We also provide tools that can help those studies to overcome these issues. And in the next time, we need to calculate vaccine effectiveness. But then came Omicron, and we are now using those modeling methods we developed to try to predict what will happen next in Israel. And the truth is that it doesn't look so good. The vaccines, unfortunately, provide very little protection against infection and transmission, so no more indirect protection. And it's important to say that they do provide protection against severe disease, but with the numbers of infections, there will still be a lot of patients with severe disease. The politicians, once again, think that everything is under control, just like here. And in Israel, there are now essentially 0 NPIs, and Omicron is spreading in a speed we haven't seen before. I'm now using my power throughout this year on social media, in interviews on national television, to try to influence decision makers to take action. But unfortunately, it currently doesn't look that we're able to really move the needle enough, at least on the decision makers. But maybe I think that the public is listening to what we are saying. They are understanding that maybe we're here, but we're going to be here very soon. And we are seeing now significant reduction in mobility in Israel, which will hopefully slow down the curve. Sorry for ending in such a pessimistic note. Rui?
Well, thanks very much, Dvir. I was hoping we're going to end on a positive note, so I'm going to formulate my questions in a way that will lead us there, I hope. Okay, but maybe we can start with, I think something very unique that we've seen here is the use of social media for scientists. It has been, I think before the pandemic, it's been a tool to kind of communicate information between scientists. And now it's kind of, it breaks that boundary and increase the circle of influence much more. And I think especially for your studies, they've made amazing impact over social network, especially over Twitter. So I wonder if you could maybe start by commenting about that, about how this tool has gone with the pandemic and how it is now being used for science communication at the many different circles, at your own disciplines and to the wider general public community.
Yeah, so I think, I use Twitter because I was in the US, in Stanford. Everybody uses Twitter, but for work. It's a great tool for scientists to communicate with other scientists, and I've done it for several years. But we've all seen that since this start of the pandemic, Twitter allows scientists to go down from the ivory tower and communicate with the public, communicate their science. I think it's amazing. So I'm only one, for many scientists that are sharing their analysis online. I think it's a major change. As I don't know, of course as a kid, but I never thought of being in interaction with prominent scientists that you can do now. Talk with the top health communicators in the US, scientists in the US, and we're all sharing information that is rapidly spread. It allows us not just to communicate, also the other thing, and this is very important here, that everything changes every day, really shares real-time science, because you wrote a paper on Delta, and 3 months later it's published, and half a year later it's published in Nature. Who cares by then? It doesn't have any effect by then. So those tools, I think, are very important, and I really hope they'll remain after COVID hopefully ends in the near future.
Thank you. So it
That
looks
was
from
optimistic, right?
it looks from your presentation that you are not optimistic about the prospect of achieving herd immunity, especially with Omicron, as even though the vaccines are working well in reducing risk of severe infection, they do much less in reducing infectivity and transmission of the virus in the community. And first, I just want to see that that really concludes your perspective. And if so, and since we are trying to conclude on an optimistic note, I'm trying to ask, what did we learn, and whether for new waves to come, with new variants to come, are we better prepared? Are we better prepared in the way we gather data, in the way we analyze data, in the technologies we have to predict the disease and to treat it? So if you could comment on that, and ideally leave us on a positive note.
Sure. So regarding herd immunity, I think it's a silly thought. We are all good if to get herd immunity here with such a the R0 of Omicron is so high, and herd immunity is defined as 1 minus 1 divided by the R0, the basic reproduction rate. We will need 80-90% of the population to get infected, and if that will happen, our hospitals will collapse much before. That's not going to happen because people are smart. People stop, as we see now on mobility data. People stay home and they reduce their interactions, and then you get to some kind of. That's why waves end, because you get the 1 minus 1 divided by the effective R, which is with all the mitigations. That will bring, but that won't be what we really care about, which is the real herd immunity. And it just means that once we change our ways, another wave will come. So I don't think that people should think that, yeah, let's just finish, let's just everybody get infected, we'll get over with it, and we can move on to the next, we can move on with our life. That is not going to happen. And of course, pi will come afterwards. After I was very pessimistic here, I want to finish with some more optimistic note. I'll share my screen again. That already makes me optimistic. But since the start of the pandemic, we've seen this arms race between the human and in this virus. And we learned a few things that we're now much better positioned to fight virus, and not just the virus, I think other diseases. And I want to give 4 reasons. One is data. The Ministry of Health is now has data scientists. Who would have thought of that 2 years ago? This is major change. There is so much public data, public sharing across scientists around the world. I say this pandemic moved us 10, 20 years. This all started before the pandemic, but it just pushed this sharing of data and data science in health many, many, many years forward. We know the rapid testing technologies, and they're getting better and better on every day. You mentioned the studies from the Technion, and we're going to have more and more. And that will be relevant for us in COVID. Just think about it. If we can easily test ourselves cheap, you spit into a cup every day, and if you have a virus or something like that, that will be tremendous. We are very close to that, and there's going to be more and more technologies like that are not just for COVID, just for flu and for many other diseases. This ability to diagnose yourself at home. Again, I think COVID pushed us very, very far to the future. Improved vaccines. So we all know this mRNA vaccines that nobody thought in 2020 that this is something that will happen before 2030 or 2040. And now we have a 4th round of mRNA vaccine. The mRNA vaccines, now this technology can be used for many, many other diseases, for cancer, for example, and I'm sure we're going to see clinical trials very, very soon for curing cancer with mRNA vaccines. This is, for me, the cancer researcher, is a very, very exciting direction, and there are more technologies that there was no chance that we will even think of developing before this pandemic, that will hopefully help us move beyond COVID and be ready for the next virus that will come in 5 or 10 years, but also for many, many other diseases. And the last thing is improved medications. Yeah, so we all know Paxlovid that is reducing 90% of severe diseases. But again, there's so much development and it moved so much faster throughout. Nobody thought before, we had Tamiflu, I don't know, for virus. Nobody thought really to treat viruses because it's not something that we know really how to handle. And again, this is, to me, makes me very optimistic that most of us are going to survive COVID, and the future ahead is we're much better positioned to fight both the next virus and other diseases. So I hope this is a much more optimistic note to end.
Thank you, indeed, very much. So thank you, Dvir, and thanks to all three speakers for really fascinating presentations. And we're now going to move to the Q&A session. The Q&A session is going to be orchestrated by Jerry Kleinman. Jerry, please join us and start us off with the first question. Thank you.
Thank you, Roy, and thank you to all of our speakers. I'm just struck by the number of comments in the chat room, by the number of Q&A questions that have popped up on the screen, by the interaction, people talking to each other and back and forth. And this is a different dynamic than we've seen, at least that I've seen in the dozens of other webinars we've done over the last year and a half or so. So this is very, very interesting how this evolved. There's one overviewing umbrella question that seems to me the most frequent that's come through on these chats and Q&A, and that deals with the boosters and people's concerns with, are we just going to have to be boosted every 6 months? Is everybody over 60 and 70 going to have to go through that? How will that affect the immune system? Are we really entering something that is very dangerous? And are there oral or inhalant boosters that we see on the horizon? That's a broad question, I know, but one that covers more people's concerns than others.
Okay. Well, Matan, you want to try to address it a bit?
I think it's a major unknown. Here in Israel, you see that in the first booster, it took really a few time until the rest of the population got the first booster. The government decided very quickly to bring it to the whole population. And we see now with the second booster that they started with people in ages above 60, and they stopped there. So I haven't seen yet the data, but it looks like that for now, nobody is in a rush to give boosters to the whole population.
Maybe I can add, there are diseases like flu that we do give boosters annually. It happens for, I think the reason to give boosters is twofold. It's the decline in protection of the vaccine and the emergence of new variants. For flu, it has been mostly the issue of emergence of new variants, and if that's what we're going to see with Omicron, then yes, it may be the case that every so often we will have to use boosters or even revaccination with new variants. There are discussions now of cocktails that are maybe more protective against multiple variants and possibly future variants. The way we manage the flu vaccinations is every summer, like before the winter comes, there's very comprehensive studies that make a prediction to what is going to be the next variant, and the vaccines are tailored as a mix to this kind of expected population of variants that's going to come. So I think this is a scenario that is possible. To what extent, I think we can have vaccines that are long-lasting, I think it's pretty much an open question. The current vaccines, I would say, it seems that they, like we've seen, decaying in terms of the protection against infection, but over months, but are decaying way slower in terms of their protection against severe disease. And that actually makes sense also from biological point of view. We would not go into it, but it's something that does make sense, because there's some of the immunity is in antibodies, and some is in memory cells, and it is the memory cells that come and protect us later against severe disease. So I think we are all kind of waiting to have more data on this. Like you said, everyone is highly curious from personal point of view, and from like how life going to be like point of view for everyone.
So I just want to add about the data. I think that, so regarding the second booster in Israel, so until now, almost 500,000 adults have received it. There weren't any significant side effects, and we are seeing now first indications of effectiveness. In studies that look at antibodies, the effect is much lower than the third dose. But now when you look at effectiveness and reduction in cases in 60-year-olds that are vaccinated, there are very early indications that show that it's working pretty well against Omicron.
Yeah,
Right.
I wanted to comment that.
Please, Neil. Yes.
Yeah, this is just the beginning of the time window where we can start testing this, because the mass of second dose boosters were given roughly 10 days ago. So this is exactly the time, these days, where we can start talking at their effect. This is actually what Yair has been doing, preparing the grounds for that.
Mm-hmm. And maybe just to mention that, I think just like we've seen with the earlier, the rapid vaccination campaign that happened in Israel to begin with, and the first booster, and now with the second booster, it is just so happened that Israel is really leading the way, and I think it's all the eyes are on us to see what would be the impact on the disease. And there is something very special, I think, that happened in Israel with respect to not just deriving those vaccination campaigns fairly efficiently, but also being able to track this huge amount of data on demographics, on vaccination dates, on infections, on hospitalization, on deaths, God forbid, and connect all of these data sets together. That's something really very, very special that happened uniquely here. And I think this is why you've seen the studies that are coming from here. And I think we are all looking, I think the entire world, and talking with friends everywhere, they're looking to see what will studies coming from here say about exactly those questions of additional boosters, other vaccines, and so on.
Thank you. That I really appreciate that. That's very interesting. I think you touched most of the bases there. There were a number of questions also about masking, and some of the focus was on are better masks being produced? What about the Maya mask that was produced at the Technion, which I believe is a patch, if I'm not mistaken, that goes on another mask, if I'm not mistaken. But what do you see from the technology coming out of the Technion and other institutions in the area of masking?
Mm-hmm. I think we've seen with a disease in the beginning, it was thought that the virus is being carried only within what we call those micro droplets of water in the air, and therefore the masks were thought to be, even regular masks were thought to be effective. I think as we move forward, there are more indications that the virus is more airborne in the sense of really existing even with little water around, and therefore being able to penetrate more the regular masks. And there are surely many technologies that are being introduced to help improve the mask. You mentioned the Maya sticker coming from the Technion, and there are others. I don't know if any of these are actually distributed as kind of like that you can actually buy right now, but I think we should definitely keep our eyes open because things gonna change technology-wise in the very near future.
And I had one last question, because we've gone a ways here. You know, we talk about Israel's role and the special role that all of you and the Israeli scientists across the country are doing in the data collection in Israel. Do you think that Israel will continue to be looked at by the rest of the world in the same way it has been for the last year and a half? And a related question, in looking at the data, is your research solely on Israeli data, or is it shared data perhaps with the US or other countries?
Mm-hmm. Who want to take that?
So I can start. So, well, Israel was looked upon because we were very, very early. We were the first country to vaccinate our population. You can see those amazing graphs that Israel until March or April had 50% of adults of over 18 vaccinated, compared to the second country was 15 or 20%. We had all the data for months. So since January to May, no other country was even able to do those vaccine effectiveness studies. So that's, I think, the reason. And then because we vaccinated so early, we had we got the waning immunity first. So that was the interest here. And then came, I think that now with Omicron, nobody really looks at us, maybe on so we first gave the boosters, that was the third step. And now we are giving the fourth booster, but there's more boosters, and the next booster, I don't think people will be interested in boosters anymore. So we will have to see what will happen next that will make Israel interesting. I think Roy mentioned the data in Israel, which we're not the only country that have that kind of data. The US definitely doesn't, but England and other countries do have data that centralized data and they're creating a lot of very, very important studies with it. So it depends on what will happen next and what will make Israel in the forefront.
Is there any reason to, someone just asked, is there any reason to suspect that the Israeli experience is or isn't applicable in the US? Is there anything that has changed over the course of a year and a half, or any barriers to extrapolating what might happen in the US based on the Israeli experience?
Right. Maybe I can answer a bit and also connect to the question of do we look at data from abroad? Certainly, yes, a lot, especially when it comes to analyzing sequence data, so the genome of the pathogen of the virus. The collaborative effect on that is really worldwide. And any research we do here, or in which we look at how what new mutations appear, we always go and immediately compare it to studies from the entire world. Of course, a lot of it comes from the US, but not only. And with respect to extrapolating from what you see in one country to another, my sense is, when you extrapolate from the personal level, how long the vaccine protects an individual, when you know the demographics, the data of that individual, age, gender, other comorbidities, then that transfers very well. When you start to transfer what happened at the community level, things don't always work. And sometimes we are surprised that some countries have dynamics that are almost like weird and ununderstood. The way the virus is spreading is probably a lot of culture dependent and transportation dependent, and age distribution dependent, and many other things that vary between countries. So I think we've seen very different dynamics in different countries. So I think if I need to conclude, yeah, any studies that talk about the personal protection is totally transferable. Any studies that look at more like population-wide dynamics should be should be tailored to each individual country somewhat.
Thank you all. You know, we've had hundreds of people on the call, dozens of questions and chat comments, and I really want to thank you for this robust and important conversation. And you know, we're appreciative of what all of you are doing with your colleagues at the Technion. So I thank you. I know our audience thanks you, and I am pleased to have Shelley Taub come back on and bring us on home.
Muted. You're muted.
Can you hear me?
Yeah.
Okay, thank you so much, Jerry, and thank you to all of our friends at the Technion. Well, knowledge is power, and it's important to understand where that information that you're learning is coming from. And I think that we can all agree that the source of this information is beyond reliable, credible, and we are so fortunate to have these great minds behind us. We thank you so much for today. Thank you to our many viewers. We are so grateful that you've taken the time to join us today. We've recorded this program and we'll share the recording with you in the coming days. Until then, a very happy, healthy, and safe new year to all. Thank you.
Thank you. Thanks for the organization, beautiful organization, and thanks for the audience everywhere in the US and the entire world. Thank you.